Good evening, guys. Welcome to my YouTube channel. Today is another interesting Wednesday evening. I'm shooting the video right in my house. Guys, welcome. Thank you for finding it a reason to be here, finding a reason to always watch, subscribe, and like my videos. Thank you so much for the subscribers so far. Thank you so much for the views. And today, guys, I have a special edition. We're going to look at a condition. We're going to learn about something called the plantar fasciitis. This is the inflammation on your foot. So by definition, what is plantar fasciitis? Plantar fasciitis is the inflammation of the plantar fascia tissue, which runs from the bottom of the metatarsal heads right to the arc, through the arc of your foot to the toes. So this is about the feet in general, from the heel point to the toe point, and the inflammation can be caused by different there are different causes for this inflammation, and this is one common condition that make people go to see doctor or the podiatrist visits. So guys, let's go straight and see what this condition, or what causes this condition. We are calling plantar fasciitis. So yes, we're there. So what can cause this mainly are our day-to-day routine, how we use our feet, how comfortable our shoes are. So guys, this condition mostly affects people who use their feet most of the time, working, walking, doing exercises. Also, yeah, it can just happen because of a straining that you have encountered during your daily routine. So going straight to how we can manage plantar fasciitis. As you have seen, it is affecting our general our feet in general by causing an inflammation along the foot tendons, and there is inflammation at the heel point. You can see, yeah, right to the toe point. So guys, this is about that. The symptoms are just like what I have said: is pain and discomfort, and sometimes it's so severe you cannot function during the day. So going straight to where we were, we're going to look how you can manage and treat plantar fasciitis by yourself or by visiting a doctor. So there are different home therapies that you can do at home. We have the warm water therapy, cold water therapy, and let's look at the water therapy first, where we have the warm water therapy or warm water bottle. This is just a simple method of doing it. You get a bottle, fill it with warm water, right? You can see, and then using your feet, you step on the bottle and roll your foot on the bottle. This will always act like a massage you're applying to these tendons at the bottom of your feet and the heel. So this is a quite affordable method of managing this condition. As I've said, you can use ice or cold water or warm water depending on what you find fit for the inflammation you're having on your foot. So it's quite uncomfortable to have or to work with feet that are inflamed or quite in pain. It's quite difficult. So I know what I'm talking about, guys, and this is so severe. Sometimes it cannot let you function during the day. So apart from the warm water therapy, we can also get what we call braces. We can get what we call the inserts or the sole, which we insert in our shoes. So let's look at the braces as a method of managing the plantar fasciitis. You can see, guys, these are different sizes, different types of braces that you can use, and some of them you can even use at work. You can see, like this one is quite comfortable because it applies a compression on your tendons and acts like a massage, so that those tendons are not overstretched, and that helps to manage the pain. There are some braces that you cannot work with them during the day, like this one, because the feet has to be lifted up at the toe point, and this one can be used, we call them the night braces. You can apply them during the night and spend the night with them. So guys, more so we have some other nice plantar fasciitis braces. Look at these ones. You see, these ones are concentrating on the arc foot or the heel pointer, because also the pain at this point, you're supposed to relieve the pressure you are applying on the tendons at all time. That is the reason why we must have a comfortable shoe at work. When walking, wear a comfortable shoe. When exercising or going to the gym, always have the best shoe for your feet. So more to that, we can look at the inserts or the soles. These are simple sole fitting into your shoe. You have a sole, inserts, let's call them inserts, so that you quickly you can see these are inserts, or just simple. You can get them from a normal shop, you can get them from just a nearby shop. You buy and insert them into your shoe. They are soft, they are padded, so they provide a comfortable ground for your feet to be in. So even if your shoe is not comfortable, when you put this one inside, then it applies or provides a soft pad for your feet. You can see the soles. Let's zoom this one. The sole here is curved so that the tendon does not go flat on the ground, but it is curved in so that there is less pressure applied on those tendons when standing, when walking, or when doing any exercise. It can be a complete insert or a half or three-quarter insert. You can see this one doesn't go to the toe pointer. So guys, all these are very, very necessary for managing these plantar fasciitis. It doesn't need any medical attention when it's not severe. It doesn't need any doctor visits when it's not severe. You can do all this, and then at the end of it, if it is not treated by the therapy, the warm water therapy, the cold water therapy, the inserts, or the blade, you can also have to do the plantar fasciitis exercises. Let's look at this. We have just simple exercises that you can do them at home. You can see this. It's a towel which you use. You can make it cold or warm, so that now when your foot up, down, or even along like this, and this will always provide like a massage compression on the tendons or the fascia on the feet. This is a nice one because there is quick relief of the pain. There is just like a normal massage, there's always a relief of the pain on the nerves and the fascia and all that. So we can look at quickly the type of exercises that you can do. You can also use a towel pinch, where you step on a warm or cold towel and try to pinch your towel as much as you can with your toes. You can see. And then you can also use, like this lady here, she's trying to hold here and apply pressure on the foot. So in short guys, we have all these exercises that you can do at home. We have a soft ball which you can also use to roll your feet like this. You can see like this, right? Here we have a box. You can use it to stretch the tendons like this, you can see. Or up here, this is working on the toes. This is working also on the toes. So let's look at the best plantar fasciitis exercises as demonstrated. We can also use stairs, like when you have to do exercises. We can see the toe extension, towel toe curls, as we have discussed. We have the plantar fascia massage. All these guys are enabling you to massage or to provide a comfort application on the fascia or the affected tendons on your feet. So guys, apart from the home therapy you have seen, we have something else we look at. If all this does not work and it is very severe, the orthopedic can always advise you to be done or to get what we call the plantar fasciitis steroid injection. Let's look at that. Steroid injection. So this one, guys, is done by a specialist, a consultant who is specializing on this. Just don't happen at the outpatient. So you can look at this. This is a special injection given as a steroid on the affected area, the foot, the tendons, and this can only be done under an ultrasound. You're looking here, under an ultrasound. Yes, we're here. So the one giving the injection, as you can see here, is supposed to be directed by an ultrasound where to give the specific place for the injection. So it doesn't just apply normal like that. It has to be done by a consultant, mostly an anesthetist, can do this injection for you. But this is when all the other therapies work for the inflammation. So I'm sure when it gets to the worst point like this one, then you'll have tried all these other methods before you get to this. But trust me, you can do all this. The therapies are working. The warm water especially is quite easy to do, quite affordable. When sitting at home, just dip your foot inside a warm basin and then get a massage, and then I think you're good to go. Apart from that, guys, you can also use drugs or painkillers. Let's look at what type of painkillers you can use. Yes, analgesics. Let's call them analgesics, right? I know of some of them. We can call them the Flotac tablets, simply the diclofenac. We can use paracetamol. We can use the brufen. All these are painkillers. It depends which one is working best for you. So guys, just about that, you can even get an injection if the worst comes to worst. But guys, all this is meant to relieve the pain. And apart from using the therapy and then using the drug or the injection, all these, guys, it's advisable to always have a comfortable shoes when walking, when doing your exercises, your gym days. Use a comfortable shoes. So guys, just about that. Today we were looking at a condition. As I said, we have a lot to talk about, we have a lot to look at. Today we went straight to one topic or one common condition which affects most people, and we've covered the plantar fasciitis. You can Google more, you can look at more details. Just gone through it briefly, but there's so much content online. So guys, go get it. Advise people with this problem how to go about it, and all is available on your internet. So guys, thank you for finding a reason to watch my YouTube channel, to subscribe to my YouTube channel, and to view my videos. Keep on going, keep it